Hello everyone, my name is Avni Parang. I'm a recent medical graduate from India, and this video we will be talking about osteoarthritis. Osteoarthritis is a relatively common condition in our population today. In fact, most of the arthritis that we come across today in the older age group is osteoarthritis. With increasing trends in osteoarthritis, there becomes an important need and an emphasis placed on health education regarding osteoarthritis so that we can prevent and manage the same elegantly. And hopefully this video will serve the purpose of providing some more insight into osteoarthritis. So let's get to it. In this video, we will be talking very briefly about the introduction to osteoarthritis, how does it present, how do we diagnose osteoarthritis, the main modalities of treatment, and finally, what can you do to prevent osteoarthritis? So more importantly, just before we begin, osteoarthritis, just to break the word down, comes from osteo, meaning bone, arthron, which means joint, and itis, which refers to inflammation. The more common joints that are affected, as you can see in the picture here, are the knee joint, the hip joint, finger joints, the lower back, and the neck joints. The most common symptoms that patients often present to the OPD with are joint pain in the respective joint, swelling of the joint, tenderness of the joint, and an obvious reduced range of motion where the patient says that they're not able to perform as many activities as they earlier were. An important consideration would be osteoarthritis of the knee joint, where very often some patients complain of locking of the knee, where they're not completely able to extend the knee and perform the desired function. Diagnosis of osteoarthritis can be done clinically as well as on clinical radiographs like X-ray of the joint. In this X-ray, you can see this is an X-ray of the knee joint, and you can see very clearly that there is a reduced bone space in between these two bones that causes mechanical friction between the two bones, causing inflammation and eventually leading to osteoarthritis. The same pathogenesis is common for all the joints, and that's what you get to see on the X-ray. So coming to the treatment and management of osteoarthritis, most cases of osteoarthritis are very commonly managed by anti-inflammatory medication, the most common ibuprofen or any pain relieving medication. However, there may be times where this is not completely taken care of with just medication, and we are also recommended to include certain lifestyle modifications like exercising and a healthy diet, and of course weight loss. Of course, if these symptoms are not managed just by conservative measures, then we do have surgical interventions to take care of osteoarthritis. The most common joints that are involved are the hip joint and the knee joint, and surgical interventions involve replacing the joint with metallic prosthesis, just like you can see in this inset here. And joint replacement surgeries, in fact, have a very good prognosis. The patients have often said that they've had an improved quality of life and are often sought after in case that there is a deterioration of the osteoarthritis that is not controlled with just symptomatic measures. Finally, coming to prevention of osteoarthritis, while it should be noted that osteoarthritis is caused because of a lot of anatomic and genetic factors and the dynamics related to it, and subsequently cannot be completely prevented. Nevertheless, weight loss, an active lifestyle, and a healthy diet are consequential and very important to avoiding osteoarthritis. With that, I would like to conclude this video. I hope it was informative. It was a brief introduction. I will include some of the extra reading materials in the link in the description below. And thank you and have a nice day.